Chapter 1: The Silent Signal. Understanding what high blood pressure really means. High blood pressure, also known as hypertension, is often called the silent killer. And that name is not chosen lightly. For many people, it develops quietly, without obvious symptoms. You may feel perfectly fine, eat your usual meals, go about your day, and never realize that your blood vessels and heart are under stress. This is why understanding what high blood pressure really means is so important. It's not just a number on a screen, it's a signal from your body, a message about the health of your heart, your arteries, and your long-term well-being. Why high blood pressure often shows no symptoms. One of the most dangerous aspects of hypertension is its subtlety. Unlike a broken bone or a severe infection, high blood pressure rarely causes pain or immediate discomfort. You may not notice headaches, dizziness, or fatigue until damage has already occurred. Because it is often invisible, people may ignore it or delay action. You could have elevated blood pressure for months, or even years, without any obvious warning signs. Yet during this time, the strain on your heart, arteries, and kidneys continues. Over time, untreated high blood pressure increases the risk of heart attack, stroke, kidney disease, and other serious complications. This is why routine monitoring and awareness are so vital. High blood pressure is silent, but it is not powerless. The moment you understand it, you gain the ability to respond. What your numbers actually say about your health. Blood pressure is measured using two numbers, systolic and diastolic. The first number, systolic, measures the pressure in your arteries when your heart beats. The second number, diastolic, measures it when your heart rests between beats. For most adults, a normal reading is around 120 over 80 millimeters of mercury, often written as 120 over 80. But what does it mean if your numbers are higher? A reading of 130 to 139 over 80 to 89 is often called elevated or stage 1 hypertension. Many people dismiss this as just a little high. But even slightly elevated numbers, over time, increase stress on your cardiovascular system. Higher numbers indicate that your heart is working harder than it should, and your arteries may be under strain. It's a warning sign, a call to action, not a sentence of doom. Common myths that delay action. There are many misconceptions about high blood pressure that keep people from taking it seriously. Myth number 1, I feel fine, so my blood pressure must be okay. Feeling fine does not mean your blood pressure is healthy. Most people with early-stage hypertension feel completely normal. Myth number 2, high blood pressure is only dangerous when it's really high. Even moderately elevated blood pressure can cause damage over time. Waiting until it's extreme is risky. Myth number 3, medication is the only solution. While medication can be life-saving, lifestyle changes, such as diet, exercise, stress management, and sleep, can lower blood pressure and sometimes reduce or eliminate the need for medication under medical supervision. Understanding the truth behind these myths is the first step toward protecting your health. Awareness transforms uncertainty into power. When a little high becomes a serious risk. It's easy to think that small elevations in blood pressure are harmless. But even readings slightly above normal, if persistent, place extra strain on your heart and blood vessels. Over time, this can lead to thickening of the arteries, increased risk of heart attack, stroke, and kidney damage. The danger is that the body gives almost no obvious warning until serious problems develop. That's why early intervention is so important. Lowering blood pressure, even by a small amount, can dramatically reduce long-term risks. The key is not to panic, but to pay attention and act consistently. Monitoring your numbers, making gradual lifestyle changes, and working with healthcare providers are all powerful steps toward preventing serious complications. Closing thoughts for Chapter 1. High blood pressure is silent, but it is not unstoppable. The very fact that it often shows no symptoms makes awareness your most important tool. Your numbers are a signal, not a judgment. They tell a story about your cardiovascular health and the choices you make every day. By understanding what your blood pressure truly means, recognizing common myths, and responding early, even to slightly elevated readings, you can take control before it takes control of you. In the next chapter, we'll explore why your blood pressure is rising, uncovering hidden causes that many people overlook, and showing how understanding them can help you regain control and protect your heart. Chapter 2: Why Your Blood Pressure is Rising. Hidden causes you may be overlooking. High blood pressure doesn't appear out of nowhere. It is rarely the result of a single meal, a single stressful day, or a single missed workout. Instead, it develops gradually, shaped by a combination of hidden factors in your lifestyle, your environment, and sometimes your genetics. Understanding these causes is empowering. Once you know what influences your blood pressure, you can take steps to address it and regain control over your health. Stress, sleep, and emotional pressure. Let's begin with one of the most pervasive but often underestimated contributors: stress. Stress isn't just a mental state, it is a physical response. When your body senses pressure, tension, or threat, it releases hormones that raise heart rate and constrict blood vessels. Occasional stress is normal, but chronic stress keeps your cardiovascular system in a constant state of alert. Over time, this contributes to elevated blood pressure. Sleep, or lack of it, is another hidden culprit. Poor sleep increases stress hormones, disrupts your metabolism, and makes it harder for your body to repair blood vessels. Even just a few nights of insufficient sleep can temporarily raise blood pressure. When stress and poor sleep combine, your body's blood pressure regulation struggles, and that's when small elevations can become persistent. Emotional health matters too. Anxiety, frustration, and unresolved tension quietly influence blood pressure every day. Addressing these factors through relaxation techniques, mindfulness, or simply creating space to rest is not optional, it's essential. Diet traps: salt, sugar, and ultra-processed foods. Next, let's talk about food. Diet plays a powerful role in blood pressure, yet many hidden traps make it easy to unknowingly eat in ways that elevate your numbers. Excess sodium, often hidden in processed foods, canned soups, sauces, and packaged snacks, forces your body to retain fluid and increases the pressure inside your blood vessels. Added sugar, especially in drinks, desserts, and processed snacks, contributes to weight gain and metabolic changes that also elevate blood pressure. Even seemingly healthy convenience foods can be misleading. Ultra-processed products may be low in calories but high in sodium, refined carbohydrates, and unhealthy fats. The solution is simple but powerful: focus on whole, minimally processed foods. Vegetables, fruits, legumes, whole grains, lean proteins, nuts, and seeds support your heart and help your body maintain normal blood pressure naturally. Weight, inactivity, and modern lifestyle habits. Modern life often encourages inactivity. Long hours at a desk, driving, and minimal movement reduce the efficiency of your cardiovascular system. Being overweight or carrying extra abdominal fat also makes the heart work harder and contributes to higher blood pressure. But this isn't about judgment. It's about awareness. Even small increases in daily movement, walking, stretching, light household activity, can significantly lower blood pressure over time. Consistency matters more than intensity. Regular movement, combined with gradual weight management, helps the body maintain a healthy cardiovascular balance and protects against long-term complications. Genetics versus daily choices: what you can and can't control. Some factors are beyond your control. Genetics can influence how your body regulates blood pressure, how your arteries respond, and how susceptible you may be to hypertension. But genetics are not destiny. They are simply one piece of the puzzle. Your daily choices, what you eat, how you move, how you manage stress, and how well you sleep, carry immense power. They determine whether genetic predispositions manifest as serious problems or remain manageable. The goal is not to blame yourself for inherited risk. It is to understand where your influence begins, and to focus your energy there. Closing thoughts for Chapter 2. High blood pressure develops silently, shaped by hidden forces in your lifestyle, environment, and sometimes your genes. By identifying these causes, you take the first step toward meaningful change. Addressing stress, improving sleep, choosing whole foods over processed ones, moving your body consistently, and understanding your genetic risk are all tools in your control. With knowledge comes power, and with power comes the ability to lower your numbers, protect your heart, and create lasting health. Chapter 3: Lowering Blood Pressure Naturally. Daily habits that make the biggest difference. Lowering blood pressure doesn't require drastic measures or a perfect lifestyle. In fact, some of the most powerful changes are also the simplest and the most sustainable. In this chapter, we'll focus on daily habits that work with your body, not against it. These are evidence-based practical steps that many people overlook because they seem almost too easy. But when done consistently, they can make a measurable difference in your blood pressure and in how you feel every day. Let's begin with something you do multiple times a day: eating. Heart-healthy eating made simple. When people hear heart-healthy diet, they often imagine strict rules, boring meals, or giving up everything they enjoy. The truth is far more encouraging. Lowering blood pressure through food is not about perfection. It's about patterns. At its core, a blood pressure-friendly way of eating focuses on real whole foods. Foods that look close to how they came from nature. Think vegetables, fruits, beans, lentils, whole grains, nuts, seeds, fish, and modest portions of lean proteins. These foods are naturally rich in potassium, magnesium, fiber, and antioxidants, nutrients that help blood vessels relax and function properly. One of the biggest dietary drivers of high blood pressure is excess sodium, especially from processed and packaged foods. It's not always the salt shaker on your table, it's the bread, sauces, soups, snacks, and ready-made meals that quietly push sodium intake far beyond what the body needs. Rather than trying to eliminate salt completely, focus on reducing ultra-processed foods. When you cook more at home, even simple meals, you automatically lower your sodium intake while gaining control over ingredients. A helpful mindset shift is this. Instead of asking, "What must I avoid?" ask, "What can I add?" Add more vegetables to your plate. Add fruit as a snack. Add beans or lentils to meals a few times a week. These additions crowd out less helpful foods and support healthier blood pressure without feeling restrictive. The role of movement, even gentle exercise. Exercise is often presented as intense workouts or long gym sessions. But for blood pressure, consistency matters more than intensity. Regular movement helps blood vessels stay flexible, improves circulation, and reduces the strain on your heart. Even gentle activity sends a powerful signal to your body that it's safe to relax. Walking is one of the most effective and underestimated forms of exercise for lowering blood pressure. A daily walk, even at a comfortable pace, can gradually reduce both systolic and diastolic numbers. If walking feels challenging, start smaller. 5 minutes is enough to begin. So is moving around your home, stretching, or doing light household activity. The goal is not to burn calories. The goal is to move your body regularly. Movement also helps with weight management, improves sleep quality, and lowers stress hormones, all of which indirectly support healthier blood pressure. Think of exercise as medicine you take in small daily doses, not something you have to earn or suffer through. Breathing, relaxation, and nervous system balance. One of the fastest ways to influence blood pressure is through your nervous system. When you are stressed, anxious, or rushing, your body activates its fight or flight response. Heart rate increases. Blood vessels tighten. Blood pressure rises. But when you slow your breathing and relax your body, you activate the opposite system, the rest and digest response. This signals safety, allowing blood vessels to widen and pressure to fall. Simple breathing practices can lower blood pressure within minutes. A gentle method is slow, deep breathing. Inhale through your nose for about 4 seconds, exhale slowly through your mouth for 6 seconds. Just a few minutes of this can calm your heart and quiet your mind. Other relaxation practices, such as mindfulness, gentle stretching, prayer, or quiet reflection, have similar effects. They don't eliminate stress from life, but they change how your body responds to it. This is especially important if your blood pressure rises during stressful moments, doctor visits, or emotional situations. Learning to calm your nervous system is not a luxury. It's a powerful tool for long-term heart health. How small changes lead to measurable results. One of the biggest mistakes people make is believing that small changes don't matter. But blood pressure responds not to occasional effort, but to daily patterns. Reducing sodium a little. Walking a little more. Breathing deeply for a few minutes each day. Eating 1 extra serving of vegetables. Each of these changes may seem modest on its own. But together, over weeks and months, they add up. Blood vessels become more flexible. The heart works more efficiently. Numbers gradually come down. And just as importantly, confidence goes up. You begin to trust your ability to influence your health. You shift from feeling controlled by blood pressure to actively managing it. This is not about quick fixes or temporary motivation. It's about building habits that support your body quietly and. Chapter 4: Medicines, Monitoring, and Medical Support. Working with your doctor, not against them. For many people, the moment high blood pressure is diagnosed can feel overwhelming. Numbers on a screen suddenly carry weight. Conversations about medication can bring fear, resistance, or confusion. But managing blood pressure is not about choosing between medicine or lifestyle. It's about using the right tools at the right time, together. In this chapter, we'll explore how medication fits into the bigger picture, how to monitor your blood pressure accurately, and when it's essential to seek medical support without delay. When medication is necessary, and when lifestyle leads. One of the most common questions people ask is, can I lower my blood pressure without medication? The honest answer is, sometimes yes, sometimes no, and that's not a failure. For individuals with mildly elevated blood pressure, lifestyle changes alone may be enough to bring numbers down safely. Improvements in diet, movement, stress management, and sleep can have powerful effects. However, when blood pressure is significantly elevated, or when other risk factors are present, such as diabetes, kidney disease, or a history of heart problems, medication may be necessary to protect your organs while lifestyle changes take effect. Medication does not mean you've failed. It means you're reducing risk. Think of blood pressure medication as a support tool, not a life sentence. In some cases, lifestyle improvements can later reduce the need for medication, under medical supervision. The goal is not to avoid medication at all costs. The goal is to protect your heart, brain, kidneys, and blood vessels, now and in the future. How to monitor blood pressure correctly at home. Home blood pressure monitoring is one of the most effective ways to understand your true numbers. Many people experience higher readings at the doctor's office due to anxiety, a phenomenon known as white coat hypertension. At-home readings often provide a clearer picture of your day-to-day blood pressure. To get accurate results, consistency is key. Measure your blood pressure at the same times each day, usually morning and evening. Sit quietly for a few minutes beforehand. Place your feet flat on the floor and support your arm at heart level. Use a properly fitted upper arm cuff, not a wrist or finger device, whenever possible. Take 2 readings, 1 minute apart, and record the average. Over time, patterns matter more than single numbers. Monitoring is not about obsession. It's about awareness. Avoiding common mistakes that cause false readings. Many people unknowingly take blood pressure readings in ways that inflate the numbers. Talking during measurement, crossing your legs, holding your breath, or checking your blood pressure right after physical activity can all lead to falsely high readings. Even caffeine, nicotine, or a full bladder can temporarily raise blood pressure. That's why it's important to sit calmly, breathe naturally, and give your body time to settle before measuring. Avoid repeatedly checking your blood pressure out of anxiety. This can increase stress and create a cycle of worry and elevated readings. Instead, follow a simple routine and trust the process. Red flags you should never ignore. While high blood pressure often has no symptoms, certain warning signs require immediate medical attention. Severe headaches, chest pain, shortness of breath, sudden vision changes, dizziness, confusion, or numbness on one side of the body can indicate a dangerous rise in blood pressure or a medical emergency. If your readings are consistently extremely high, or if you feel something is wrong, do not wait. Seek medical care immediately. Listening to your body and responding early can be life-saving. A partnership that protects your health. Managing high blood pressure works best when you and your healthcare provider are on the same team. Ask questions. Share your home readings. Discuss side effects openly. And remember, your role is not to obey blindly, but to participate actively in your care. When medicine, lifestyle, and monitoring work together, blood pressure becomes manageable, not mysterious or frightening. In the next chapter, we'll focus on long-term confidence and building a life where your blood pressure stays under control without constant fear or struggle. Chapter 5: A Calm, Heart-Strong Life. Long-term control without fear or obsession. High blood pressure does not need to dominate your thoughts or define your future. By this point, you've learned what blood pressure is, why it rises, how lifestyle choices influence it, and how medical support fits into the picture. Now comes the most important part: living well over the long term. This final chapter is about balance. It's about moving from constant concern to quiet confidence, where caring for your heart becomes part of daily life, not a source of fear or stress. Building routines that keep blood pressure steady. The human body thrives on rhythm. When you eat regularly, move consistently, sleep adequately, and manage stress in simple ways, your blood pressure benefits from that predictability. Routines don't need to be rigid. They need to be realistic. A daily walk. Regular mealtimes with mostly whole foods. A few minutes of slow breathing before bed. Taking medication at the same time each day, if prescribed. These small anchors create stability, not just for your blood pressure, but for your nervous system as well. When healthy habits become automatic, they stop feeling like effort. They become part of who you are. And that's when long-term control truly begins. Managing setbacks without stress or guilt. No one manages blood pressure perfectly. There will be busy weeks, stressful moments, missed workouts, meals that aren't ideal, readings that are higher than you hoped. These moments are not failures, they are normal. What matters is how you respond. Guilt and panic raise blood pressure. Self-compassion lowers it. Instead of asking, "What did I do wrong?" ask, "What can I gently return to?" One healthy meal. One short walk. One calm breath. Progress is not erased by a setback. It is strengthened by your ability to reset without judgment. Staying motivated for the long run. Short-term motivation comes from fear. Long-term motivation comes from meaning. You're not lowering blood pressure just to change numbers on a screen. You're doing it to protect your brain, your heart, your kidneys, and your future quality of life. You're doing it to stay present for the people you care about. To move freely. To sleep peacefully. To age with strength and clarity. Celebrate small victories. A lower average reading. More energy during the day. Better sleep. A calmer response to stress. These signs mean your body is responding, even if progress feels slow. Consistency, not intensity, is what lasts. Turning awareness into confidence and peace of mind. At first, awareness of blood pressure can feel unsettling. But over time, awareness becomes empowerment. You understand your body better. You recognize patterns. You know when to take action, and when to relax. Blood pressure stops being a mystery. It becomes information. And with information comes choice. Confidence grows when you trust yourself to respond wisely, not react emotionally. Peace of mind comes when you realize that control does not mean obsession. It means steady care. A life led by calm, not fear. High blood pressure may be part of your story, but it does not have to be the headline. With knowledge, daily habits, medical support, and self-compassion, you can live a calm, heart-strong life, one where your health supports your goals instead of limiting them. Take things one day at a time. Breathe deeply. Move gently. Eat thoughtfully. And trust that small, consistent choices truly do add up. Your heart is resilient. Your body is capable. And you are far more in control than you may have once believed. Foods for high blood pressure. 1. Vegetables, high in potassium and fiber. Potassium helps balance sodium in the body, reducing pressure on blood vessels. Fiber supports heart health. Leafy greens, spinach, kale, Swiss chard, arugula cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, other veggies, carrots, bell peppers, beets. Tip: raw or lightly steamed preserves nutrients best. 2. Fruits, natural potassium and antioxidants. Fruits are rich in potassium, fiber and polyphenol, all of which support healthy blood pressure. Berries, blueberries, strawberries, raspberries, contain anthocyanins that relax vessels. Citrus fruits, oranges, lemons, grapefruit, vitamin C supports artery health. Bananas, especially high in potassium. Apples and pears, high in fiber and antioxidants. 3. Whole grains. Whole grains improve blood vessel function and support weight management. Oats, quinoa, brown rice, barley, whole wheat, high fiber cereals and whole grain bread, low in added sugar and sodium. 4. Legumes and beans. Rich in protein, fiber, magnesium and potassium, all helpful for blood pressure. Lentils, chickpeas, black beans, kidney beans can be added to soups, salads or stews. 5. Nuts and seeds, healthy fats and magnesium. Unsalted nuts and seeds provide heart-healthy fats, magnesium, and protein. Almonds, walnuts, pistachios, flax seeds, chia seeds, sunflower seeds. Tip: keep portions small, a handful, to avoid excess calories. 6. Fatty fish, omega-3 rich. Omega-3 fatty acids reduce inflammation, improve artery health, and may slightly lower blood pressure. Salmon, mackerel, sardines, trout. Eat 2 to 3 servings per week for maximum benefit. 7. Low-fat dairy, calcium and protein. Calcium helps maintain normal blood pressure, especially when combined with potassium. Skim or low-fat milk, yogurt, kefir. Avoid full-fat or heavily sweetened dairy products. 8. Herbs and spices, flavor without sodium. Reducing sodium is critical for blood pressure. Flavoring with herbs and spices helps. Garlic, basil, oregano, rosemary, turmeric, ginger can replace salt in cooking to reduce sodium intake. 9. Dark chocolate, in moderation. Flavonols in cocoa can improve blood vessel function and lower pressure slightly. Choose 70% cocoa or higher. Limit to 1 to 2 small squares per day. 10. Beverages that support heart health. Green tea, rich in antioxidants, may support healthy arteries. Hibiscus tea, some studies show it can lower blood pressure. Water, staying hydrated helps maintain vascular health. Key tips for using food to lower blood pressure. Focus on whole, minimally processed foods. Avoid packaged snacks and fast food. Reduce sodium intake, aim for less than 2,300 mg per day, ideally 1,500 mg per potassium-rich foods with sodium control for maximum benefit. Maintain balanced portions to support weight management. What to avoid? Here's a clear guide to foods and habits to avoid if you want to manage or lower high blood pressure. 1. High sodium foods. Too much sodium causes your body to retain water, which increases blood pressure. Avoid or limit processed meats, bacon, sausages, deli meats, canned soups and instant noodles, packaged snacks, chips, pretzels, crackers, fast food and restaurant meals, often very high in salt, sauces, soy sauce, ketchup, and salad dressings with added sodium. Tip: check labels. Look for less than or equal to 140 mg sodium per serving for low sodium. 2. Sugary foods and drinks. Excess sugar can contribute to weight gain, insulin resistance, and inflammation, all of which raise blood pressure. Avoid or limit sugary sodas, energy drinks, sweetened teas, desserts, cakes, cookies, pastries, ice cream, sweetened cereals, or flavored yogurts. Tip: opt for fresh fruit if you crave sweetness. 3. Saturated and trans fats. Unhealthy fats can clog arteries and worsen heart health. Avoid or limit fried foods, fast food, margarine with trans fats, shortening fatty cuts of red meat, full-fat cheeses and creamy sauces. Tip: use olive oil, avocado, nuts and seeds instead. 4. Excess alcohol. Drinking too much alcohol can raise blood pressure and damage your heart. Men, no more than 2 drinks per day. Women, no more than 1 drink per day. Tip: if possible, reduce or eliminate alcohol to support healthy blood pressure. 5. Caffeine, moderation. Caffeine can temporarily spike blood pressure in some people. Limit coffee, energy drinks, and strong teas if you are sensitive. Monitor how your body responds. 6. Highly processed and fast foods. These often combine high salt, unhealthy fats, and added sugars, all contributing to hypertension. Frozen meals, packaged snacks, fast food combos, processed cheese. Tip: focus on home-cooked meals with fresh ingredients. 7. Excessive red meat. While lean portions are okay, frequent consumption of red meat can increase cardiovascular risk. Tip: choose lean poultry, fish, legumes or plant-based proteins instead. General lifestyle tips to avoid high blood pressure. Don't smoke, nicotine constricts blood vessels. Avoid prolonged stress, practice relaxation or breathing exercises. Limit sedentary behavior, move regularly throughout the day. Are eggs good for high blood pressure? Yes, eggs can be part of a heart-healthy diet and may be included in a blood pressure-friendly eating plan, but there are some important considerations. Why eggs can be beneficial. High-quality protein eggs are rich in complete protein, which supports muscle and overall metabolism. Adequate protein can help maintain a healthy weight, which is important for blood pressure control. Nutrients that support heart health. Eggs contain vitamins and minerals like vitamin D, B12, selenium and choline. Choline supports nerve and heart function. Low in sodium, naturally. 1 large egg has only about 70 mg of sodium, making it a good option compared to processed breakfast foods. Considerations for blood pressure. Watch added salt. Boiled, poached, or scrambled eggs without excessive salt are ideal. Avoid adding large amounts of salt or processed toppings. Cooking method matters. Frying eggs in large amounts of butter or oil may add saturated fats. Use minimal olive oil, avocado oil, or non-stick cooking spray. Balance your meal. Pair eggs with vegetables, whole grain toast, or fruit rather than processed meats like bacon or sausages, which are high in sodium and can raise blood pressure. Recommended approach. Moderation. 1 to 2 eggs per day is considered safe for most healthy adults. Combine with heart-healthy foods, veggies, whole grains, and healthy fats. Monitor cholesterol if needed. Most people can eat eggs safely, but if you have high cholesterol or cardiovascular disease, discuss with your doctor. Summary: eggs are generally safe and can be beneficial for high blood pressure when eaten in moderation and prepared healthily, especially as part of a diet rich in vegetables, fruits, whole grains, and lean proteins.